In pain management, we use PRP, which is called platelet-rich plasma. So you can take the blood from your vein here, and we spin it down, and we get a supernatant fluid, which is nice and clean, kind of like a yellow, serous material that has all the platelet-rich plasma, meaning it's high in platelets, and all the anti-inflammatory and growth factors are concentrated in this 5 cc vial. We take that and inject it where the pain is. So we can inject it into joints, we can inject it into the muscles where there's pain, and that's called PRP, platelet-rich plasma. If you're a sick person, meaning you're metabolically compromised and you're toxic, it may not be as healthy as somebody who's younger and less toxic. So when patients are older, I would also supplement the PRP with exosomes. Now, exosomes are extracellular particles. They have messenger RNA, and they work between the cells. Your paracrine activity, which is different from endocrine. Endocrine glands are like the thyroid, testicles, adrenals, and all that. They pump out hormones. But paracrine is between the cells, and there are a lot of communication going on between all your cells in your body. And exosomes kind of accentuate those signals to the right parts of the body, different organs. Patients who are injected intravenously exosomes, patient who had COPD actually got better. I did a pulmonary function test before I did the program with her, and about 5 to 6 months later, she was quite surprised that the pulmonary function test had greatly improved. But of course, I did make her lose some weight, I put her back on hormones, and she did not need as many inhalers and stuff like that she was taking all the time. Exosomes can actually regenerate cells, whether it be the lung tissue or muscle tissue in the heart, and it has multiple growth factors. So exosomes are very powerful stuff that you can use, and I kind of mix it with the PRP for pain control. The problem with pain medication, they all have side effects. Most pain medications are narcotics, either mild narcotics or severe narcotics. And it's a shame that people go to pain clinics, start getting mild narcotics, then it goes to much stronger narcotics, and then it goes to injections or even a pain pump. Now when you have a pain pump with Dilaudid or morphine, now you have to deal with all the side effects. Number one is going to slow your body down. So you have problems with eliminating your bowels, so you get constipated. And a lot of people come to me as a urologist because now they have urinary issues. They have problems with holding the urine because they have problems with overflow incontinence, meaning the bladder is full, and once it's overfull, it just kind of leaks out, so you don't have any control. Once you get patients off pain medication, your bowels get better, your bladder starts to work better, your muscles are working better, you're breathing better, your brain is now working better because it's not under the influence of drugs. Especially in these days of opioid crisis, there are so many people dying from opioid medications. So it is more common these days for patients to actually come for non-narcotic pain management. Pain management in our clinic is usually better healthy eating, weight loss, moderate exercise, pump up the hormones, and use PRP or exosome. I have pain patients who had pain for decades now have hardly any pain because now they are living a much healthier lifestyle.